We want to shed a little bit of light on some of the health conditions that impact Latinos disproportionately. Hispanics are 1.5 more times likely to be diagnosed with Alzheimer's and dementia, according to the Alzheimer's Association. While the disease has a history of robbing people of their past and present, one expert we spoke with gives some hope for the future. ABC 10 News reporter Sierra Encinas shares her personal story as a San Diego County clinic works to make a difference for families fighting the disease.
Hi, Ma.
Whether we want to admit it, we all have a favorite person in life. For me, that person was my grandma, or as I like to call her, my mom. She sacrificed a lot for our family. She was there when I learned to crawl. She took care of me. She loved photos. Toward the end of her life, photos are what helped her remember. Just like she took care of me, I took care of her during her final weeks. My mom was diagnosed with Alzheimer's about 4 years before she passed away. It's a disease that the Alzheimer's Association says impacts the Hispanic community 1.5 times more than white people. With a family history of the disease, I fear I'll be diagnosed with it one day.
I'm sorry to hear this in the family.
So I sat down with an Alzheimer's disease expert, Dr. Jose Soria Lopez. His work at the Neuron Clinic in San Diego County has the potential to help shape the future of treatment and care.
I predict that the next 5, 7, 10 years, there's going to be even more changes to come, more medications available, more diagnostics pathways. And along the way, we want to make sure that historically underrepresented groups can get access.
In the past 1.5 years, he says developments have come a long way.
We now have the ability to do blood tests and very early on be able to do detection.
Disease-modifying medicines are also available.
Intravenous anti-monoclonal antibodies, these are a group of medications that target the pathology, that target the bad proteins that affect memory early on.
Dr. Soria Lopez offers the drugs at his clinic and monitors patients through clinical trials. He and his research assistants say they've seen the drugs reverse some of the disease's symptoms, like memory loss. He says medicine isn't for everyone, though. The drugs available are for people in the early stages of Alzheimer's.
It can be very scary to come to an office, to a clinical office, a large office, for the first time, having a referral, not knowing what you're going to see, not knowing the people you're going to find, whether those individuals can relate to you and what you've been through.
The neurologist says access to health insurance, transportation, and support are barriers that impact detection and treatment in the Hispanic community. He says family plays a big role in detecting the changes that come with the disease.
A lot of times within the Hispanic Latino community, we don't like to talk about things. It might be looked at as maybe disrespectful or we just shouldn't ask type of a thing. Why is it so important that we stop that stigma and that we talk about our medical history so that we can prevent things in the future?
If we open up, if we bring these symptoms to our primary care doctors, if we then get referrals to a specialist and the specialist can evaluate us and provide us treatment, we are then representing the Latino community and the Hispanic community in those newly available treatment pathways.
Dr. Soria Lopez says education about a family history and monitoring things like sleep quality, cholesterol, blood pressure, and hearing loss later in life can all help. While options for detection and treatment weren't available for Ma, I can now remember her through the photos and memories she left behind, and I can hold on to the hope that more are on the way. Sierra Encinas, ABC 10 News.